1 in 8 households suffer from food insecurity. Too often, when they ask for help, they're treated as less than and shamed. Have you ever wondered what it would mean to provide food with true dignity? That's the question at the heart of our conversation with Angel Swanson, the founder and executive director of Feeding Feasible Feasts.
We put them in places where they're available 24/7. The doors close on their own. They do count attendance, so we can participate in some of these programs. They can be solar powered, but even if they're not, they can hold up to 6 tons of food.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together.
24/7 access to food with choice. Imagine that being the model to treat food insecurity in this nation. Welcome to our series on Food is Medicine, a conversation that has become increasingly important in healthcare. 1 in 8 households in the US are food insecure, and 1 in 3 people have prediabetes or diabetes, nutrition-related illnesses that carry a massive toll. In fact, 18% of costs in the healthcare system can be attributed to diabetes, stroke, and cardiovascular disease, all of which are directly linked to nutrition. This is a real problem, and healthcare clinicians and systems can't just sit on the sideline and ignore it. But the solution requires more than what sometimes feels natural for healthcare to do. Standardization through a few recommended diets, like the Mediterranean diet, or medically tailored meals to solve this problem. We'll learn from Angel, food is much more than just a manufactured meal. It's connected to culture, identity, mental health, social connections, and a lot more. In this episode, we'll learn from Angel, whose innovative approach challenges the traditional model of food banks and pantries. Rather than placing rigid requirements, Angel's organization, Feeding Feasible Feasts, has created 24/7 accessible food hubs where people can freely access the food they need whenever they need it. The focus is on dignity. It's just the beginning of Angel's holistic vision. Her work is about the interconnections between food justice, food sovereignty, and nutritious sustenance that nourishes both the body and the soul. And really, instead of imposing a narrow definition of quote-unquote healthy, Angel works hard to adapt traditional recipes to preserve the emotional and spiritual significance of the foods that bring her community comfort and connection. For me, her vision offers a powerful example of what's possible when we approach food-related challenges with creativity, empathy, and a deep respect for the cultural identity of the communities that we serve and what food means to them. Here's Angel to share more about her work and the transformative power of food. Welcome to the show, Angel.
Hello, Raj. My name is Angel Swanson, and I am the founder and executive director for Feeding Feasible Feasts. I'm also a mom of 7 and a grandma of 12. I'm retired, but now I'm doing this instead.
Yeah, this is what your retirement looks like. Let's get into it. I want to hear about your vision for your organization, Angel, because I was so impressed reading your website about this hub program and the sheer accessibility of what you created compared to what I imagine as a food bank, which is crowded. I stand in line. Somebody hands me a bag of who knows what I'm going to get. I shouldn't complain because I got to be grateful for whatever I get, right? That's a vision I think many people have and as reality for many folks. What are you doing differently?
There's quite a bit that we're doing differently and for a variety of reasons. But I will say, not necessarily in defense of food banks, they are necessary, but they are under different constraints than we've decided to partake in. They are mostly government funded, state and federal, and driven by needing to collect data. They can only pass out what they are allowed to bring in. So they are under some constraints that we don't have. Now, as far as our programs are concerned, our food hub is, in short, it's like other popular movements. It meets the required needs of a large number of people and families. When I first moved to this state, I lived in Auburn, where the big casino is now. I had 5 children, pregnant with 2, and I had to walk down a hill every day to visit the food bank. no transportation. Documentation was required at every visit. It didn't matter how often I came or whether they knew me by my first name and my children. There were times I couldn't receive food because it was left behind. What I learned during that experience was that dignity didn't matter. You were put in a position where you could only participate in this effort if you met certain requirements. When opening our food banks, we decided to go a completely different route. Food hubs really did come around by accident. We started with a small garden giving away food. That eventually grew into an outdoor corner free market for people. From there, we built an outdoor shed to put the food in. This was necessary because what we found were that people needed this food. They didn't want to have to explain why they needed the food. And the stigma that sometimes goes behind having to make those explanations or write in those numbers, who are they supporting? So again, not meaning to throw shade at anyone, but what we discovered that many of these food banks work with little to no money, have high thresholds of mandated data collection, and we didn't have that. So when we built this hub, the hub answered all of the issues, right? When we first started with the corner market, I had a young woman come to my door at 2 a.m. She turned out to be deaf and mute. In the backseat of her car was a child. All she wanted to know was, did I have any milk? I walked around the side of my house and we got her a gallon of milk out of one of the refrigerators I had stored on the side of the house to hold food. And away she went. And it occurred to me that 24/7 access was necessary. This is a young woman who was getting off work, had no money to go to a store, and her baby needed food for in the morning, right? Understanding that accessibility, she's not the only one. So in building that unit, we answered all of those problems. We put them in places where they're available 24/7. The doors close on their own. They do count attendance, so we can participate in some of these programs. They can be solar powered, but even if they're not, they can hold up to 6 tons of food. We fill them generally 5 days a week. There are a few that we do 7 days a week. They're signed in the 3 local languages. We try to address every stigma, offer all the dignity we could find. And it became clear that we needed to meet people where they were on their journey. Are you a mom who's at home all day and doesn't have transportation? Are you a young man who's in college but working nights, right? We needed to address all of those things. And this is what the hub is designed to do. My staff and I, we learned that each circumstance is unique as we assist populations. And with that, we've attempted to just offer equal opportunity to what we have. And this was a way for us of learning this exposure to new and unexplored circumstances that they matter. And we learned a deeper sense of what it means to understand one another. Because I think a lot of times that is also lost in the translation with formal programs, that those things are not seen anymore, that they're not heard.
That's incredible. Maybe themes that I hear. One is dignity that is repeated in everything that you're designing. I think the other unsaid value is trust, because I can imagine some people worry, wait, 24/7, anybody can walk in anytime? Like, are you sure that's okay? What if one person takes all the food? Then you won't have others. Tell me a little bit more about that. Were you ever worried? Do you feel like that's a original concern?
I'll tell you that when we built the second hub, we bought a van so that we had a staff person fill that hub far away from our location. All of my vans travel with hazmat kits. There's a part of me that deeply believed that somebody was going to eventually pee inside one of those lockers. You feel these things innately and you're just worried about them, right? But what we came to find out, for example, that folks who do come and take too much food, we get emails all the time. The email sounds something along the lines of, oh, there was a white Subaru that came and it was license plate, blah, 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 and they took all the food. We work deeply with a therapist who works in food insecurity and food deprivation. And what she explained to us is that, yes, there are going to be folks who are going to come in and immediately begin to hoard food. But what you're doing is reassuring them that you are addressing the deepest need, which is, when am I going to ever have food again? And once they learn that hub is always there and always has some food in it, and if it doesn't at that moment, it will the next day. They know now that they don't have to hoard that food, that they will always have somewhere to go to get food. We've been able to develop a model where our communities can trust more, and it's a very symbiotic relationship.
That's profound, because I think there's an answer to that question that could have been different if it wasn't for you or your team, right? When you walk in there, there's only one crate you can get. We have cameras in there, so we know who's coming in. If anybody takes more than one crate, there's the feeling of responding to that fear in a way that we controlling it. But you were generous and actually found a different way to address this phenomenon that does happen, right?
That's how other programs spun off, right? When we did find folks that were constantly returning and taking too much, we would meet them and have a conversation. It was never along the lines of you have to stop or you can't come back. Oftentimes we discovered that they were collecting for more than one family. They were perhaps collecting for an entire community, especially if they didn't speak English. We would take those folks aside and offer other sources of taking food so that they're not taking so much from the community pantry.
How do you feel the national programs for somebody experiencing food deprivation? I can't imagine the complexity of WIC, SNAP, which people know about, but then there's NSLP, SBP, SVS, SFSPC. What is the gap there, given there's so many national programs to address this? Where was it falling short? In what way?
In speaking to those programs, first and foremost, are not funded well. When you compare them to the population of people that need food, I find that our federal and state organizations like WSDA are constantly at battle trying to get more of a budget into those programs so that more is available to more people. The shortfalls for us is, for example, in WIC, especially if we're going to talk today about cultural foods, there's a very limited amount or, I guess, variety in the types of foods you can choose in those programs. TFAP and EFAP are federally funded programs where you will have a lead food bank buy or receive large quantities of food, and then they disperse those foods throughout to smaller food banks or smaller agencies or agencies that are not lead agencies. And in that, again, no control over what you're seeking. For example, if there's a large TFAP shipment of whole milk, there will be a large contingent of people who cannot drink whole milk for religious reasons, for diet reasons, for just a variety of reasons, right? So then that falls short. We actually have a grant coming up at the first of the year for SNAP and WIC programs where we're going to modernize those programs. Our proposal has been to reach more people because we sincerely believe not enough young people or people who don't speak English are aware that these programs even exist. WIC has hardships when you receive that coupon. Standing in line with an EBT card or a debit card, the cashier has gone through the trouble of ringing everything up and they swipe your card. You pick 24 ounces of peanut butter as opposed to 12, and now you have to start all over again. That is so embarrassing and belittling. Too many people will not go back to do that. But there are ways around those things, and that's what we've proposed. A lot of the programs can be more than they are. They won't be the full answer, but they can be more than what they are right now.
You're a great collaborator because you're so generous when you talk about other programs and other organizations. And we all have to evolve and meet the need of communities. Yeah. And this is what we're going to work together.
This is rampant within all industries, and this one is no different. There's a sense of competition, and most of that is birthed through needing to write grants against one another in a bid to receive funding. Sometimes it's things where people think, well, I can take your program, do better. And what they end up doing, like we have some programs out there where people can receive foods in a system where they don't have to approach anyone, but they need internet access, or the program has to receive power at all times. So just a variety of additional barriers that are, in my mind, unnecessary.
Tell me about other components to your organization. Could I hear more about your program solutions for schools and other organizations?
As far as our schools and other nonprofits are concerned, we do the traditional things, which are providing food for mass giveaways for people to show up and receive food. In one school district, we partner with their Business Leaders Association. We purchase foods for their sick room and all their classrooms from grade 3 and down. The teacher at the beginning of the year can apply to us to receive a filing cabinet or a bookcase where we will deliver all of the foods to the business leaders group. Students there will take the foods to each of those elementary schools for the teachers to use when they see a child crashing or is hungry. They're able to offer a snack. And those things come from us. In that collaboration, we're able to show the elementary school students that the high schoolers care. The teacher can stop at any moment and say, here's a granola bar. I see you have your head down. Our high schoolers learn about a business model and how to support their community in a way that is meaningful to the students, teachers, and administrators within the school. We think way outside the box. We just see something and say, let's do that. And then the question becomes, why isn't everybody else doing that? And what's the obstacles? Because if there weren't any obstacles, people would be doing this, right? So that's what we try to address. That's an example of a school program that we do within an entire school district for them.
That's amazing. I want to follow this thread of creativity under constraints. And what you're saying is your ability to do that from both programs that I'm hearing. And I think other people, maybe with constraints, become more narrow, but you're more expansive of finding those ideas that work. I want to understand what it feels like for you to figure out where are those ideas coming from and what is the process? What does that creativity look like for you when you're addressing food insecurity and food access?
It starts with the question, what do they need?
Mm-hmm.
That's where it comes from. And then we work backwards from that. And wherever we land is where we land. That's where the innovation comes from. I am what's considered a serial entrepreneur. I've had 5 different businesses in my lifetime. All of those businesses address the same thing. What is needed and how do we do that? My staff understand that. My 2 project managers are 2 of my adult children that I had to headhunt from other companies and brought them in because they think like I do. Mind you, we grew up very poor. We never understood, why can't that happen? Why can't we just let people take food when they need it? It didn't make sense to us until we did it. And other agencies came to us and said, well, you can't do that. And we said, but we are. We're already doing that. I remember when we built the first hub, I got a phone call. I still have the message. I listened to it periodically to bolster myself. But it was the director of another food bank who said, I don't know what your end game is, but if you keep this up, I'm going to have to visit your food bank because nobody's coming here. I remember thinking to myself, okay, stop doing whatever it is you're doing that they don't want to do.
Yeah, you got to do better then. Yeah.
It isn't us. We're trying to help. We're not trying to put you out of business. We just feel like we're an extra resource. There's no way that we could alone service an entire community. Why would we feel like we need to eliminate competition? We're here to supplement. That is, we're picking up all the people that can't make it to that agency for whatever reasons.
Sometimes it feels abstract or maybe a little cliche, focusing on abundance versus scarcity. It can land in a way that doesn't make sense when you're really in a deprivation mindset. But I think you're explaining in a way that makes sense. I'm not trying to compete. We all have our community. You got to do something different when nobody wants to go to yours. But we need your help too.
That's the thing, we really do. Everyone in this industry right now that's doing this work is desperately needed. Mm-hmm. Make no mistake about it. Desperately needed.
Any other programs or highlights that you want to share?
We've been reclaiming food, which is how we started with the hubs. I have a small private road and I had go backs from warehousing in semi trucks backing down my private road to deliver foods. Reclaiming food has become a buzzword or a buzz topic for a lot of agencies. But we have been reclaiming food for the last 5 years very heavily. And so we are partnered with Safeways. We're in a grant with Seattle Public Utilities, where we pick up foods like many other agencies do from Safeways. The foods that are still perfectly sellable, have plenty of shelf life left on them. We recover those foods. And oftentimes they were going into the hub program. But now we decided to put a spin on that. How else can we get food to people other than putting them in hubs? Because we only have 21. That's for 5 counties. That's not nearly enough. So how do we meet people where they are? What occurred to us was that I could act as a transportation model to pick this food up and drop it off at agencies like senior centers and homeless shelters where people have a high need for food assistance. The agency that receives that food then disperses it. This is in an effort to reduce waste, not just get food to people, healthy, good food, but the CO2 emissions, the water used, the landfill efforts, all of these things, we are looking at how do we reduce all of this stuff at the same time. So we get this done. Now, of course, I'm banging doors because I'm thinking to myself, we need electric vehicles. If we really are going to do this thing, why are we not driving electric vehicles, right? To me, this is a story and it has not ended because we need to make sure that we're doing all we can to reduce CO2 emissions.
Speak like an entrepreneur. I'm going to ask a question that I didn't even put on the list. How do you expand while staying focused? How do you draw boundaries on what is my responsibility and what I'm building here, and how do I stay focused for the mission, but still address all these interconnected topics affecting the ultimate well-being of your community.
Addressing those interconnected topics are a happy coincidence. It's not something that was the focus of whatever we're doing. It's a byproduct. And so we happily embrace that. When it's said to me, we need to help reduce CO2, all I could think of were my trucks and vans until I realized that the food going into landfill was creating CO2 also. So to me, it just made sense that let's just do all the CO2 that we're putting out there, right? When it comes to resiliency and infrastructure, there is grant money out there for those efforts. It's not just food that grant money can be applied to. Recently, we gave a Pacific Islander group, all trans women, who support children and give food to very large freezers. Again, pulls very little power, but they need that infrastructure, right?
We talked about food insecurity, but I want to talk about nutritious food, about the actual food that you choose that is culturally appropriate for the Black community. We've talked about Black cuisine as inherently unhealthy. And I think that's been a hard thing to digest for me, but often happens in healthcare. Of name whatever Black cuisine you want, but we say that's unhealthy. You need to eat alternative X, which is not from your culture. Tell me more about how you approach this topic of nutritious food for the Black community.
In that whole food justice piece, you can't talk about that unless you're also talking about food sovereignty. This goes directly to African American people, right? As a general principle, I just don't think you can talk about the two things separately. Emphasizing health benefits when you're consuming nutritious foods to prevent illnesses, you have to understand that the concept of food sovereignty, which advocates for communities' rights to control their own food systems, these two things have important connections, very important. And so while a lot of cultures practice preserving food sovereignty, I think it's lost on people that our historical context for food when it comes to being African American. During the Atlantic slave trade, millions of Africans were forcibly taken, brought here under brutal conditions, but we have never lacked the ability to answer our problems. We came here with seeds literally braided in our hair of the foods that we knew we needed, not just nutritionally. For us, food has also been a mental exercise. Smelling your grandmother's cooking and remembering the stories that she tells you, right? All of those things matter to us. In carrying those seeds and bringing them here, Africans taught their slave owners how to grow those crops, the rice, okra, collard greens, black-eyed peas, yams, and peppers, all kinds of things. We eat commonly today in the United States, but we are the ones who taught those irrigations and processing techniques because our people were talented. They didn't come here uneducated. In our world, when we talk about the survival methods, cultural preservation, resistance, and hope, that's all tied together. What it takes for food to be nutritious for us gets lost because I think you and I spoke to this before. We'll have kale. You can't cook kale the way you cook collards. I'm sorry, you just can't do it. Now, can collards be cooked in more nutritious? I grow collards in my garden, as well as turnip greens and mustard greens. And I cook them in different variations together. Do I have to put ham fat in there? It depends. If I'm really feeling it, yeah. But sometimes I can just put smoked turkey in there. I still get that smoky flavor. And now I have addressed both things, right? I've addressed my cultural need for holistic food and the healthy, nutritious portion of that food. So in some recipes, you can add or subtract or substitute small portions or items. It doesn't really change the dish. It doesn't change the meaning of the dish, right? And I think that's what's lost. And so everyone doesn't think that way. And so since they don't, when a physician or nutritionist says you have to eat healthier, the answer should be, what are you putting in your collards? How much ham are you consuming? That's the answer, to me anyway, in talking about food justice, food nutrition, and food sovereignty. Those three things don't have to live separately. They can be addressed together at the same time. That would create more learning opportunities for nutritionists and others to understand that yams don't have to be cooked with butter necessarily all the time. or maybe smaller amounts of butter, but can still keep the flavors that we need to make it feel like it's home, to make it feel like it's helping us, not just our bodies, but our minds. Those are the things I think that are lost.
Yeah, I love that. So there is not only the food itself, but the cooking methods and small incremental changes rather than radical changes in cuisine. I pose the question black and white that Black cuisine is unhealthy, which is not. Any cuisine can be unhealthy, right? I eat Indian food, and if I go out to eat chicken tikka masala every day, I don't think that'll be healthy either. So I think it's this assumption that we're internalized of which cuisine is healthy and which is not, rather than focusing on what is your cultural food, what are you doing with it right now, what are small changes you could make. And yes, it's okay sometime for your mental health to do it like your mom did or grandma did, right? No shame in that, giving people the permission to make that decision, but giving them both the knowledge and tools necessary to make the decision for their health, right? That autonomy piece, right? Yep. Lovely. And anything else that you would add for advice for clinicians or nutritionists about talking about food as medicine? What does food as medicine mean to you?
I think it means several things to me. For clinicians, nutritionists, doctors, when they think food is medicine, they think physical. Your blood pressure is high. Your family is prone to diabetes. Their focus is there. But I think a lot of times that mental piece is missed. How does food make you feel? If food makes you happy, if food makes you feel whole, and you need these particular things for cultural preservation or to remember, what can we do to help you still enjoy those foods, but make them so that your body survives that, right? I think that approach could be taken, and I think it would be received well. I don't think any of us want to give up the things we love. My entire family has high blood pressure. That is a legacy of being a slave that made the transatlantic travels bearable because of the high salt contents, right?
Yep.
We are prone and we inherited that. The professionals that do this work, if they could sit and talk with their patients and ask about these foods, right? Understand that we were given rations as slaves, and they were always high salt, high starch, high everything wrong because they were cheap. We were not allowed to grow gardens. Sometimes we could hunt wild, but the things that we can do now can be pointed out. I grow a very large garden, and I grow all of the fruits and vegetables. I remember moving here and going to the store to get collard greens. My jaw just about hit the ground when I saw how much they wanted for one bundle of collard greens. I was like, are you joking with me right now? Holy cow. I couldn't afford collard greens. And all I could think to myself was, who's pricing this? But then I began to understand that I was so in the minority that to bring those things in was expensive for the retailer, and they needed to cover those costs. And so if I wanted it bad enough, I would pay. What we need to do is encourage more. I know people find gardening sometimes to be tedious or hard, but gardening and raising your own food really is the answer. There are so many things on the market now. I don't know if you've seen those little towers where you can grow lettuce and things inside your house. You can grow collard greens in those, mustards too. I teach porch gardening because most people who live in apartments have a small patio that they can't really even stand out on. But you can put pots out there and you can grow your own sunflower seeds. You can grow yams. You can grow any number of things in those pots and preserve them for yourself, right? It does more than provide food for you. It gives you a sense of being able to care for yourself in a whole, right? So again, that body meets your mind moment.
One of the worst things we did in healthcare, but maybe in society, is separate the body and mind. Saying this is your physical health, this is your mental health, without really acknowledging how interconnected that is. I'm curious about what would it mean for the community. We talked about different programs, but this connection to land and land access and idea of growing your own food. I know there's community gardens, and with food justice, there's a lot of focus on growing your own food because there's so much power in that. What does it mean for what you're building on getting people access to grow their own food rather than coming to pick it up? And what does that look like in the best of worlds from what you're hearing from the community?
The first thing that I hear from people is, I can't grow anything. I kill everything I touch. My suggestion always is to try a product first that you can't actually kill. You could overwater it, underwater it, whatever. It's going to give you something, right? Just to build your confidence, because that's all it is. It's just confidence. It really isn't as much of a talent as people think it is. The plants grow themselves. You just need to know when to water them, what to plant them in, and make sure they have enough light. That's it. The plant will grow itself. And so I think that if we spent more time as a community offering those suggestions, making more people available for those things. I teach a preserving class for people who do grow food. They'll grow certain things, but then they don't preserve any of it. They think they have to eat all those tomatoes right now, right? No, you don't. You can hop in a hot water bath on your stove, right? Or you can dehydrate it. There's so many ways to preserve that good food that you grew. We do have 2 food forests that we've put out for people. And these are just trees that come back every year on their own, as well as bushes and herbs that come back on their own every year. It was a matter of simply getting a plot of land and putting the roots in the ground and letting those things grow. When everything is ready for harvest, families are invited to go in and pick and take what they need. It's a community effort. And I think that if we could have insurance money spent on efforts like that, it would mean the world to certain communities to know that children can walk home from school and mom texts and says, hey, could you stop by that food forest and grab me some broccoli or get me a bag of apples, please, and bring them back with you, right? All of those things can happen. We just don't do them.
Good transition. What do we do with healthcare? From a healthcare perspective, it's delineated by this pyramid that I sent out as we build out a food as medicine paradigm. What feedback you would give for healthcare executives, organizations that are starting to design this program. I want to go from top to bottom in this pyramid. I'll tell you what the program is. The top level is the sickest patients who are getting hospitalized due to some chronic health condition. Could be uncontrolled diabetes, etc. The middle levels are less intensive interventions for people who are ill but are not getting hospitalized. They just got diagnosed with hypertension, and some change in their nutrition could help them live longer. And then the lowest level is the population level. Like everybody could use this. So going from the top, often for this top segment of population, I think the current interventions are typically called medically tailored meals, that we prepare meals tailored by dietitian nutritionists. So Angel, I have a nutritionist in our healthcare organization. They're going to tell us what's healthy for somebody with diabetes. We're going to package it. I'll send it to your home, Angel. You're going to feel better. What do you think about that?
I think that if they're going to do that, they should check in with each patient. What foods on my list are best for you? And how would you cook them? So let's pretend for a moment that it's an elderly Black woman like me who loves collard green. Let's say yams or sweet potatoes are up. And I see that on there. And she says, I would love to have yams. I would think that the interview should include what ingredients do you need for this? And then they give the list of ingredients, which usually is brown sugar, syrup, sometimes maple syrup, and cloves. Almost all of those foods right there are good foods to eat. But checking with that patient and saying, what is involved in this recipe? What can we take out? What can we substitute with? What makes sense to make this food something that you're going to want to eat? How do we make you want to eat this? How do we help you? You and I both know it starts cooking in the oven and people are like, when is it going to be ready? That's what you want. That's what you're looking for.
I learned at some conference that nutritious food can be delicious. And delicious means something different for everybody. But you have to believe that to make that happen, not just have a narrow sense of what is nutritious.
Right.
All right. So now we're going to the middle level, which is the people who are sick but not hospitalized. So we're actually going to do 2 things, Angel. We're going to do medically tailored groceries. So we're going to pre-select healthy food items and then also give you produce prescriptions. So here's a discount card that you can take to this grocery store, a major chain, and you can use it for these items. Here's a voucher with some benefit, but you can't buy anything else. I want to see if that will be helpful for your community, Angel. What do you think?
Absolutely. If you were to give someone a card where they could pick any produce they want, it might just be oranges, but it is still produce, right? It's still going to carry those nutrients in it that they need. So yes, that's a great idea.
Okay, great. So you're saying I should allow people to pick out anything they want, but should I reduce it somehow?
I don't know if I would limit people. If you say it can only be a leafy green and they may not use it because this week they're really not in the mood for leafy greens. That happens. But if there's some alternatives for leafy green, maybe this type of fresh beans or bagged beans or whatever other thing that can fit that nutrient piece that doctor or physician is looking for. If it's iron, it doesn't have to necessarily be a leafy green. If you're trying to listen to the patient, what do they like? Is there anything in there that can fit that particular need and say, okay, this is what I want you to use this for?
Yeah, that sounds great. I'm playing role playing. People with SNAP, though, they are buying like Coca-Colas and all that. Should we be really strict about it, Angel? I'm just worried. We don't want to make it worse, give people free money and they're just getting processed foods. I want to do our best to make sure we're really strict about it. Is that okay?
Yeah, the short answer is no. The thing, when you start constraining people in a way where they have no choice, then they always try to figure out the way to do the thing you don't want them to do. That's just human nature. That is something I've discovered in our hubs. I had a dream one night, a memory of being a child and being asked to produce a snack. If you brought a snack today, you can have it. And being the only child in that classroom that didn't have a snack. And the embarrassment that went with that. As a result, in the hub, we started putting all of the snacky stuff low where the kids could see it. And what we found was the parents would usually choose one or two of them on their own, and everything else they chose was stuff that was needed for actual meals. But I don't think that by limiting, that's the answer, because it never works. They're going to give that, hey, I need to go pick up a 7-pack of Pepsi. Can you buy that and use the cash to get my soda? Yeah. Rather than address the actual need with them.
That's helpful because you want to educate people in a compassionate way around the why and do motivational interviewing, coaching, whatever it takes to get them to make the right choice, but then give them the autonomy to make choices. The next rung of this pyramid is everybody. And really, we think of educating around government nutrition security programs, SNAP, WIC, school meals. Just thinking about that because it's just so overwhelming. So we're going to connect you to these programs because you may not know about them. Let's just talk about education, package labeling, menu labeling. What does it mean? And then think about how to make sure everybody understands that. So when they're shopping at a grocery store, they know what they're buying. What do you think about that?
I think it's great. I think that the education piece and especially label reading, that can be overwhelming, especially if you're talking about second language folk and that is not translated for them. In some of the work that we're doing right now, we're experimenting with some of the new Microsoft programming and some of the computers with real-time translation, which seems to be meaningful and helpful for people when we talk to people about those kinds of things. So I would encourage tools like that.
About educating people on nutrition security programs. So we screen for them and then refer them to SNAP, WIC.
First of all, address why they don't know about these programs, the obstacle, right? And I'll tell you in our proposal to SNAP and WIC, and the way we run our grant is addressing that. Why in the world are people still putting posters up and billboards up of SNAP and WIC? Is that really how young people right now are getting their information? Think about that. They're not going to get on the website for the state and look at it. And they're not. So they don't know. And it's embarrassing. So they're not going to talk to their friends about it. So what do you got to do? You have to go where they are. You have to tell people where they are. The other piece would be to make sure that whoever they interact with is someone they can identify with and doesn't make them feel less than. The biggest complaint in my polling of young people who did sign up for WIC was that the nurses were rude. They were made to feel like they didn't know what they were doing. I don't think that was the nurse's intention, but that's how it was taken. And so I think that sometimes in the way that we talk to people, in the way that we invite them to do things, should be addressed. I think a lot of that lies on us.
A very important component, which it's important to think about because we think it's so straightforward. We just got to tell you about WIC, but how are you talking about it? And why don't you know about it yet? And what is that root cause of awareness of a government program that's accessible to you, which is good. Yep.
WIC enrollment is down a bit, but the thing that it's very low right now are people going back to re-up their coupons, to re-up the benefits. It isn't necessarily in the enrollment. It's their experience with WIC that is preventing them from coming back. And those are some of the things that we have proposed to address and have figured out a way to address. It's one thing to enroll people, the follow through is the most important piece, right? And why are we only targeting women? There are young men, fathers, grandparents, aunts and uncles, right? We need to target the children's families, not just the mother.
Yeah, that's a great piece to advocate for, even for Medicaid. You can get coverage if you're pregnant, but once you've given birth, you lose coverage, right? This feeling
Right.
high needs times, but what happens to the person who is going through these phases? So important to call out there. Any other takeaways?
I appreciate what you're doing right now. I think that more people need to think holistically about the people they serve.
Yeah.
That just think about who these people are and that they're just people and that everyone deserves dignity in what they do and how they receive any advice or help. This all comes down to dignity.
Tell me about your favorite meal. I know you like yams. I know you like collard greens, but I want your favorite childhood memory meal that you crave. What does that look like?
My comfort food is baked ham with a brown sugar glaze, collard greens with mustards, pickled beets, and corn on the cob.
Oh my gosh. I'm ready to share a meal with you. I'm going to come there.
Okay. I've got 40 cans of pickled beets right now. 40 jars.
Thank you again for all the incredible work you're doing. It's so important. I'm hoping we can amplify both your vision, your intent, and the values that you hold doing the work for others coming to the space and emphasizing the collaboration that's needed rather than competition.
Thank you, Raj, for having me. I appreciate your work.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized, topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.